Now to the latest on the Ebola crisis. A group of armed people attacked and looted a quarantine center for Ebola patients in Liberia's capital, Monrovia. Health workers say 20 patients either fled after the attack or were forcibly taken by family members. In addition, Doctors Without Borders say the crisis is likely to last at least another 6 months. We have two reports, beginning with VOA's Zlatica Hoke.
Security forces in Guinea demolished a slum in the capital Conakry on Thursday in an attempt to fight the spread of Ebola in the West African state. The action is part of the presidential campaign to clean up crowded areas where the virus could easily spread.
When we say a slum, this is all kind of dangerous. So we are so happy for the help today to destroy these houses. This area was very dangerous for the population and the women who dried fish, and also for the security of the presidential barracks.
Conakry is believed to be one of the dirtiest cities in West Africa, but to the people who live there, it is home.
What they are doing to us is not good. We are Ghanaian. We are not strangers here. Why all this? Because of Ebola. Leave us so that Ebola can kill us, but don't move us from here.
The humanitarian group Doctors Without Borders said Thursday that the spread of Ebola in Guinea, the initial epicenter of the outbreak, has now slowed and the focus has moved to Liberia and other places. The group's president Joanne Liu said the Ebola crisis will last at least 6 months under the best of circumstances. She spoke in Geneva after a 10-day visit to the region.
I really had the feeling that it is like a wartime. In terms of fear, general fear all over where you are, nobody not understanding what's going on.
Liu said the World Health Organization must do more to stabilize the region, especially Liberia.
WHO needs to take a leadership and bring some strong element into the field that are operational. And this needs to happen at all levels.
Fear has prompted some countries to suspend flights to West Africa. The World Health Organization says it is not necessary.
Air travel is a low risk for the transmission of Ebola because Ebola is not an airborne disease. Ebola is transmitted by contact of sick person, and the transmission is done by the body fluid.
The Ebola outbreak has killed more than 1,000 people this year and sickened about 2,000 others. The symptoms include fever, muscular pain, vomiting, diarrhea, and bleeding as vital organs begin breaking down. There is no proven cure. Experts say an early response is essential.
It's really important for people to come into the facility immediately upon having symptoms.
Several vaccines are in early stages of development. The World Health Organization has declared it is ethical to use insufficiently tested drugs and vaccines in such exceptionally dire circumstances. Zlatica Hoke, VOA News, Washington.
Ebola is likely to hurt economic growth and government finances in Guinea, Liberia, and Sierra Leone, and perhaps Nigeria. According to a key analyst, UN officials say efforts to stop the spread of the deadly disease are affecting 1 million people. As VOA's Jim Randle reports, prevention efforts are crimping commerce, sports, travel, and trade.
Ebola sparks fear and protest, demanding stronger and smarter government action. It's spread by contact with blood or other body fluids of infected people, which is why it has killed scores of medical workers and forced some hospitals to close. Moody's credit rating service says the cost of fighting Ebola will strain national budgets, while the slowdown in commerce will cut tax revenues and could make measurable cuts in each country's annual GDP growth. Experts say this outbreak is hurting the economy more than previous ones in Africa because it is in a more populated area. Nigerian-born economics professor Benjamin Akande is worried. He is the dean of the Webster University's Business School in the United States, and he spoke to VOA via Skype.
The economic implications of this Ebola virus is staggering. And it is staggering because it is on the edge of possibly shutting down the economic lifeline for the affected countries.
Moody's says Ebola is likely to disrupt air travel and other critical commercial and transport activities for at least a month. Some airlines are demanding hand washing and temperature checks for passengers, while others have canceled flights. Officials have also closed some borders, banned some public gatherings and sports events, and told some workers to stay home. This shopkeeper says it's all hurting commerce.
But since then, the customers are low. You understand?
A Wesleyan University disease expert says Ebola has killed more than 1,000 people and is likely to kill more. But the human and economic toll of other diseases like malaria is higher, according to William Johnston. He spoke via Skype.
Approximately 207 million cases with 627,000 deaths from malaria itself in 2012. Tuberculosis, they counted about 8.6 million new cases.
Amesh Adaja, an infectious disease expert at the University of Pittsburgh Medical Center, says competing priorities are one reason there is no effective vaccine or treatment widely available yet.
Ebola affects a very small proportion of the population. These outbreaks are sporadic, explosive, and then disappear. They're controlled using very low-tech measures that are low cost, and each outbreak has been stopped using these low-tech measures up until this one.
Number one, we go wash we hand. We go use sanitizer.
Those low-tech measures include telling potential victims how to avoid infection, providing more protective suits and gloves for health workers, and a dose of soap, water, and bleach. But so far, officials have not convinced enough people to use those measures, and the disease is not contained. Jim Randle, VOA News, Washington.
We want to know what you think about Africa 54 and the stories we cover. Join the conversation on Facebook and check out our headlines 24/7 on voaafrica.com.